my name's Iveth, and I am a health insurance navigator here at the Health Point in Federal Way. And what my job consists of is mostly just helping people apply for insurance, EBT, and kind of just giving resources for what they need help with regarding either like food or insurance applications. So I get a lot of patients who particularly have language barriers, which could be hard and intimidating for most patients when they go to certain places to try and even take the step to apply for insurance. Coming in and having someone to help them has been a big part of the journey, just being able to build those types of relationship with the patients. I feel like helping people is my favorite part. I get a lot of patients who sometimes they don't think they'll be eligible for certain, like the free state insurance, and when you give them that like result, it's a huge relief off of their backs. They're not gonna have to worry about medical debt. We had a patient who came in speaking a different language. I believe she spoke Dari. She had gone to the emergency room on a Saturday, and they had helped her and her children apply for insurance. But when I went into her application, they had selected her for insurance where she was paying $700 a month, but that's because they had marked her as unlawfully present. So once we went through the application, we got her sister to interpret for us. We were able to correctly update her application and see that she was here lawfully present, therefore she was eligible for the free Medicaid insurance. So that was a shock to her. But then being able to leave with the results of having free insurance for the next year for her and her children was kind of such a relief for her. Hoping maybe in the near future we can have some new laws that will help people instead of tear them down, you know, especially with insurance. It's really hard right now. They're doing a lot of like tax credit cuts, which helps patients pay for insurance. And unfortunately, with those kinds of cuts, a lot of people will be having to pay more for insurance. It will place people in situations where they'll have to choose between insurance or food or housing, you know. So I'm hoping that in the near future we can have some policies placed where it would benefit a lot of people with their health insurance. We're always here to help, and that, you know, whatever we can do to help is what we're here for. You know, we're just here to make people's lives a little bit easier, and let them know that this is a safe place for them to talk or apply and just kind of let everything off their shoulders.